So what happened in these muscle activities? We recorded from the hand flexor muscles, extensor muscles, and also the masseter muscles. I mean the bite. This, when we take a food, we use the masseter muscles, and also from the perioral muscles. In each cases, the activity of the EMGs increased compared to the at rest. See, grip the towels. Surely the EMG increases. Grip the towel firmly. Surely increases much more. But the grip the cushion, I mean the high repulsion cushion, much more strong activity changes compared to the towel. And grip the towel firmly, grip the cushion grip firmly, much more activity was obtained. Also the same for the extensor muscles. Say, pay attention to these two charts, One is recorded from the activity masseter muscles, I mean the bite muscle. At rest, very low activity. Even the wrist extension, there are no changes. But the bite, of course, this is masseter muscles. By biting, the EMG is increased. But interestingly, when we make a wrist grip, activity of the masseter muscles, it was increased. So I first doubted, that means somewhere we are biting some masseter muscles. So we took the activity while mouth opening and wrist grip. Even so, by wrist grip, the masseter muscle was increased. The same was obtained from perioral muscle around the lip. At rest, very low activities at the perioral muscles. When we list the grip very strongly, the perioral muscle activity was increased. So that means by using the hands, I mean the flexion, extension movement of the hands, not only the forearm activity, flexion, extension, but also the activity of the face muscles, masseter muscles or perioral muscle is increased. So what happens in the brain? So we monitor the oxyhemoglobin changes by near-infrared spectrometry. That means oxygenated hemoglobin changes. At rest, as you can see, blood flow of the frontal cortex is something like this. By grasping towels intermittently, the motor areas or premotor areas increase because this is due to the motor activities. But the frontal cortex, there's no changes. Surprisingly, when we grasp the high repulsion cushion intermittently, not only motor areas, but also the frontal, especially pole areas, blood flow was increased very much. Among the peoples, we checked 50 patients. Some recovered words. I mean, patients who lost the speech after cerebral infarction. They recovered the words in 1 month by using a grip. Something ouch, heart, or the ouch, or the name of the killers. And the face of the muscles of the face muscles become very tender and mild. I think this mechanism is due to this chart, As you can see, in the cerebral cortex, even the sensory areas or the motor cortexes, hand areas occupies very huge areas. But Next to the hands, there are the faces, mouth, tongue. So also they occupied very huge areas. And these hands and face areas interact each other. So when we apply the very natural good stimulus to the hand, this stimuli get into the sensory areas, then transmitted to the frontal cortex, to the area number 44 or number 45 that innervate the lips on the faces. So natural stimuli to the hands and this function of the hands was recovered. The stimuli or the output to the around the faces is ameliorated. That means by the release of the contraction of the hands, some patients can recover the languages. So, in summary, high repulsive cushion grip made from tangles, polyester fibers, and by using that grip for 24 hours, I mean continuously, over 1 month, the hand contracture, rigidity of the muscles, and movement range of the angles was ameliorated. Thus, the grip overthrew the established theory. That is, it's better not to grasp any object in hand at the opening of the hand fingers exasperate the rigidity. But this was not correct. We overthrew this concept. And in some patients, as I showed before, they recovered the languages, also the face expression was become very tender and mild. EMG activity was increased much, and blood flow of cerebral, especially frontal cortex, was increased. These beneficial effects, I think, is surely based on its rhythmic, high repulsive power of this grip. This is the point of our source point of our grip. However, the voluntary movement or sensory neglect are not recovered well. Thus, using these high repulsive cushions, the biased input to the spinal brainstem of the brain was ameliorated. Then the improvement of contracture or the decrease of the muscle tonus was obtained. So we opened to the road to the further rehabilitations. As you know, right now in Japan, about 4 million of people is suffer from dementia. In some, the data, in 2100, I mean, the 86 years in future, the lifespan of Japanese people is 94. That means we got many people, we will get many people, elderly people in our societies. So this grip is working in such the social problems and make assist for the societies. Thank you very much.